Good afternoon, everybody. My name is Carl, I'm a recovery coach here at Cat Recovery. This is our family meeting for the day. And the month of September is Suicide Prevention Month and Recovery Month as well. So our topic today is family therapy can help for people in recovery from mental illness or addiction. So it talks about mental illness or addiction. And we're starting right into it. In the introduction, when someone is affected by mental illness or addiction, it can affect the entire family. When that person enters treatment, the family's pain and confusion don't just go away. How does any family member move past the damage that has occurred? How does the family as a whole strengthen the ties that hold it together? Family therapy is one answer. It works together with individual therapy for the benefit of all of the family members. It says, what is the family therapy? What is family therapy? Family therapy is based on the idea that family is a system of different parts. A change in any part of the system will trigger changes in all the other parts. This means that when one member of the family is affected by behavioral health disorder, such as mental illness or addiction, everyone is affected. As a result, family dynamics can change in unhealthy ways. Lies and secrets can build up into the family. Some family members may take on too much responsibility of other family members, may act out in some way, just shut down. Sometimes conditions at home are already unhappy behave before a family member's mental illness or addiction emerges. That person's changing behaviors can throw the family into even greater turmoil. Often the family remains stuck in unhealthy patterns even after the family member with behavioral health disorder moves into recovery. Even in the best circumstances, families can find it hard to adjust to the person in their midst who is recovering, who is behaving differently than before, and who needs support. Family therapy can help the family as a whole recover as heal, and it can help all members of the family make specific positive changes as the person in recovery changes. These changes can help all family members heal from their trauma or mental illness or addiction. So it talks about what is family therapy. So it doesn't have to be therapy, right? It can be counseling. It can be with a third person that you can trust and confide in. It can be with a sponsor. It could be with a pastor. It could be somebody that you can trust and confide in that can help you further along in your recovery, right? But this is talking about like therapy. It's always good to seek professional help to address family issues, right? If somebody's dealing with mental illness and addiction, because we know it's co-occurring, it's together a lot of times, and it's always good to seek professional help and always good to get outside help to better families, because, a lot of times that, family members can hurt each other, sometimes physically, but a lot of times verbally, so it's hard to deal with family members in addiction or with mental illness. So it's always good to get outside help. So we'll go into who can attend family therapy. Says family means a group of two or more people with close and enduring emotional ties. Using this definition, each person in treatment for behavioral health disorder can have a unique set of family members. Therapists don't decide who should be in the family therapy. Instead, they ask, who is most important to you? Sometimes members of the family live together, but sometimes they live apart. Either way, if they are considered family by the person in treatment, they can be included in the family therapy. So it's got a few things here. It says parents, spouses or partners, in-laws, siblings, children, elected, chosen, or honorary family members, other relatives, step-parents, step-children, foster parents, foster children, godparents, godchildren, blended family members, extended family members, friends, fellow veterans, colleagues who care, mentors, multiple help group members, and sponsors. So we just talked about a few of them things. So they can always welcome, in a therapy session. And if it's like an intervention or just the setting of trying to help somebody, you always want people that love and care you, and because um, it's a bad spot when somebody's suffering with mental illness and addiction, and it takes loving and caring and choice of words and choice of people that you have in the sessions or in the just you want a good environment. You want good people, good environment, and you don't want to cause more harm than good. You know. Um, we'll go on to the next. When should family therapy start? Family therapy is typically introduced after the individual in treatment for mental illness or addiction has made progress in recovery. This could be a few months after treatment starts or a year or more later. Timing is important because people new to recovery have a lot to do. They are working to remain stable in their new patterns of behavior and ways of thinking. They are just beginning to face the many changes they must make to stay mentally healthy or to remain sober. They are learning such things as how to deal with urges to fall into old patterns, how to resist triggers and cravings, how to adhere the medication regimens, and how to avoid temptations to rationalize and make excuses. For them to explore family issues at the same time can be too much. It can potentially contribute to the relapse into a mental illness or substance use behaviors. Family therapy tends to be most helpful once the person is in treatment and fully committed to the recovery process and is ready to make more changes. The person's counselor can advise on the best times to start that family therapy. Hmm. I like so there's stages of people's recovery, right? There's different pathways or whatever, and they're talking about not overloading somebody, right? When somebody's early in recovery or vulnerable or and not a good headspace, um, we have to timing's key. Timing it can plays a big part. You don't want to overwhelm somebody. You don't want to drive them away, right? So there's timing is key, and it's always good to get stabilized first, whatever that case may be. Medication, um, you know, meetings, and there's a regimen that you have to find for the recovering addict to help them further along in their recovery, right? There's a pattern, there's a process, and if you put too much on at one time, it can cause more damage than good. So baby steps, one thing at a time, and timing is key. And it talks about you can talk to the closest person, the counselor or the therapist or whatever, to see how that individual is doing. So when you do have some therapy sessions and counseling or whatever the case may be, and don't put too much on them. All right. So what happens in a particular session? There are many things that you can happen in a family therapy. A session can be devoted to about talking about family concerns and how people are feeling. Family members might use the session to talk about a particular crisis or problem that needs solving. Yes. Or they might want to focus on the changes that have been happening. Another possible topic for a family therapy session is coping skills, such as how to deal with anger, regret, or sadness. Sometimes just letting our feelings and talking about them in therapy sessions can bring relief, understanding, and healing. Very true. It worked for me, right? Sometimes just letting go of what the baggage and the damage and the regrets and the sadness and everything I have in me. It's always to have a release valve, and that's not just a one-time deal. Even through recovery, through life, it's always good to get this stuff out, especially with somebody that you can trust and care about. And this particular thing is talking about, a therapist and counseling, and wherever that looks like for you. It's always good to let go. Um, the focus on this session might be on learning how to communicate more efficiency with each other. For example, therapists might coach a family member to speak up, to practice saying no to unreasonable demands, or to give a compliment. Family members might be asked to rephrase a statement in a more positive way. A therapist also might help family members improve their listening and observing skills to reduce misunderstanding. Mm. Sometimes the therapist asks family members to do homework before the next session. For example, the therapist might ask family members to watch for nice things that other family members say during their week. A therapist might ask family members to eat a meal together or do something fun together, like play board games or go bowling. The homework is designed to help family members practice new and healthier ways of behaving with each other. And so this is a family session, right? So it starts with the individual, right? And it goes out to the family. So everybody has to be on board. Um, and, as that addict or the, person dealing with mental illness, they suffer, right? So, and due to the person suffering, the family does. So the family has to come together and get better, right? We have to, because if you think about it, the individual gets better, right? He's in recovery, he's doing what he's got to do, but the family members still hasn't let go of the anger, the resentments, or whatever the case may be, the stuff they're holding on to, and they're not willing to let go, right? Usually that conflict is going to keep on arising, you know, and that's going to be causing more chaos, more drama, more bickering, more arguments. So it usually ends up toxic. So it has to go into the family and they have to heal and deal with their process as well. Let's see here. What if family members are unwilling to take part? Sometimes family members are unwilling to join family therapy. There are many possible reasons for this. Fear, they may prefer to have the family unit stay as it is, even if that is painful, rather than take the chance with the unknown. Fatigue, they may be tired of dealing with the issues. Concerns about power, they may feel that they have an advantage the way things are, or that they don't, but family therapy won't fix it. Distrust, they may be unwilling to risk speaking frankly with other family members or in front of a therapist. Skepticism, yeah, that word. They may not be convinced that the family therapy will be useful, or they may feel or have tried it before and not liked it. It may help to have the family therapist talk on one-to-one with unwilling family members together. They can't identify the reasons for resistance, figure out how to resolve concerns, and discuss the benefits of family therapy. Sometimes what's needed is simply time. Willing members of the family can choose to get started. Unwilling members can join when they are ready. So yeah, the timing is key. And if they're unwilling, um, there's something going on. There's barriers there, so we have to eliminate the barriers. And he talks about distrust. They're just tired of dealing with the issues. They want to put it on the back burner. They rather put it off than dealing with it head on. And fear of the unknown. That's very prevalent for a lot of us, and for me as well. Um, fear of who I'm going to become, and fear of uh, a lot of changes coming. Because recovery is about change and growth, and that can be scary as well. But this is very important. Like everybody's got to be on board. And if somebody's not willing to take part, they're just not they're unwilling. So you have to meet them where they're at. We have to meet that person where they're at and be loving and caring about it. let's go to the last part here. Is family therapy effective? Research suggests that behavioral health treatment that includes family therapy works better than treatment that does not for people with mental illness. Family therapy in conjunction with individual treatment can increase medication adherence, reduce rates of relapse and rehospitalization, reduce psychiatric symptoms, and relieve stress. For people with addiction, family therapy can help them decide to enter or stay in treatment. It can reduce their risk of dropping out of treatment. It can also reduce their continued use of alcohol or drugs, discourage relapse, and promote long-term recovery. Family therapy benefits other family members besides the person in treatment by making positive changes in family dynamics. And therapy can reduce the burden of stress that other family members feel. It can prevent additional family members from moving into drug or alcohol use. Research also shows that family therapy can improve in how couples treat each other, how children behave, and how the whole family gets along, and how the family connects with its neighbors. Family therapy isn't always easy. There will be struggles for everyone involved, but the outcome is worth it. Family therapy is an effective way to help the person in treatment while also helping the family as a whole. Mm, love that last part. It helps the individual and it helps the family as a whole. So that's why I said everybody's got to be on board. Everybody's got to be loving, caring, supportive. Um, and it talks about it's a struggle. Life's a struggle, but when times are hard, it's even more harder than in the tough times. But good things come, right? Family support is very important, and the support for the family is very important. Like I said earlier, I think it's very important to help the individual, right? But it's also important to help the family members get through their uh, process as well. So I think this is a great article. And this article is family therapy can help for people in recovery from mental illness or addiction. That was our family meeting for the day. Remember, September is Suicide Prevention Month and Recovery Month as well. Until next time, my name is Carl. I'm a recovery coach here at Camp Recovery. Until next time.